Brooke, my name's Rachel. So today, before we do anything or sort any exercises out, we need to go through this adult pre-exercise screening tool. And the reason we do this is so that we can get as much medical information about you as possible and to try and identify any contraindications to exercise. So contraindications are anything that may be present that could be harmful to you while you're exercising. First of all, I'm going to ask stage 1 and then we'll go through and ask stage 2. So first of all, can I have your date of birth?
22nd of the 1st, 91.
Okay. So the aims of stage 1 is to identify those individuals with a known disease or symptoms or signs of disease who may be at a higher risk of an adverse event through physical activity or exercise. Has your doctor ever told you that you have a heart condition or have you ever suffered a stroke? No. Do you ever experience unexplained pains in your chest or at rest or during physical activity?
No.
Do you ever feel faint or have spells of dizziness during physical exercise that causes you to lose your balance?
No.
Have you had an asthma attack requiring immediate medical attention any time over the last 12 months?
No.
No. If you have diabetes, type 1 or 2, have you ever had trouble controlling your blood glucose in the last 3 months? No. Do you have any diagnosed muscle, bone or joint problems that you've been told could be made worse by participation in physical activity?
No.
No. Do you have any other medical conditions that make it dangerous for you to participate in physical activity? No. Okay, now because you've answered no to all of these questions and you have no other concerns about your health, we can proceed to undertake light to moderate intensity physical exercise. But before we do that, we'll go to stage 2. And I'll just ask you some questions which are aimed at to identify individuals with risk factors or other conditions to assist with an appropriate exercise program. So your age is 18 and you're obviously a female. Is there any family history of heart disease, stroke, heart attack in your immediate family?
No.
So that would be father, mother. No? Perfect. Okay. Do you smoke cigarettes? Ever?
No.
Okay. Describe your current physical activity. So do you do physical activity being less than 150 minutes a week, or would you do daily exercise? Roughly how many minutes a day would you exercise?
What sort of exercise?
Physical exercise. So a sedentary exercise would be activities that usually involve sitting or lying.
No.
And have little additional movement.
No.
Light exercise would be very light to light aerobic activity that does not cause a noticeable change in breath. So if you don't
probably light then.
So you do light exercise, and how many minutes per day would you roughly do that? Half an hour, an hour?
Probably.
Go for a walk?
While I'm at work.
When you're at work?
So probably the whole time I'm at work.
So that would be
most of the time.
Light exercise, would you say 5 days a week?
Yeah.
And would you say approximately an hour, 125 minutes? How many minutes a week would you say for the duration?
Probably 600.
Okay, perfect.
Roughly
600? Okay, we'll work on that. Do you know how high you are in centimetres?
162 centimetres.
Okay. And what is your weight in
54.
kilos? 54. So from this, we can work out your BMI. Now, BMI doesn't take into effect your muscle mass, but it's calculated by your height and your weight. So we've pre-worked this out, and you have a BMI of 20.57, which is less than 30 kilos per metre squared, which means you have a low risk factor here, which is good news. Have you ever been told that you have high blood pressure?
No.
Have you ever been told that you have high cholesterol?
No.
Have you ever been told that you have high blood sugar?
No.
Perfect. So through this assessment so far, we've got 0 risk factors, which is really good news. Have you spent time in hospital, including day admission for any medical condition, illness over the last 12 months? No. Are you currently taking any prescribed medication?
No.
Have you been pregnant or given birth within the last 12 months?
No.
And do you have any muscle, bone or joint soreness or pain that could be made worse by activity?
No.
Okay, perfect. So according to this assessment in stage 2, your risk stratification is 0, which is really good news, and it means that you're a low risk client, and it means that we can look at participating you or starting you in some aerobic physical activity, exercise up to a vigorous or high intensity. Thanks.